So, where do we go from here? First, we take a breath. It's a lot. And in some ways, we humans were not designed for a crisis this massive and all-encompassing. In other ways, we were made for this moment. What we do now is dream. From a foundation of science and community, we must imagine the future we want to live in and the future we want to pass on. And every day, do something to reel the dream closer to reality.
Hello, listeners. Welcome to Season 2, Episode 4 of the Truth, Courage, and Solutions podcast. This episode, we are focusing on health and safety in relation to climate change. My name is Allison Stater, co-host and current Master of Nursing student at Viterbo University.
And my name is Marie Fursa, also a co-host and current Master of Nursing student at Viterbo. Here with us today, we have Dr. Shanda Demorest, who is currently the Director of Sustainability Solutions at an organization called Practice Greenhealth. So welcome, Dr. Demorest, and thank you so much for taking the time to speak with us today.
Hey, Marie and Allison, so glad to be here. Thanks for the invite.
Well, to get us started, could you tell us about your professional journey that led to your current role as the Director of Sustainability Solutions at Practice Greenhealth?
Yeah, absolutely. Well, considering you're calling in from somewhere around Viterbo, I imagine I'll share that I grew up in La Crescent, Minnesota. So I was a kid that was out in the bluffs and the river region and like grew to understand nature as just a very important portion of my life.
Mm-hmm.
I ended up in nursing school, and I thought that I would be getting, honestly, like more content around environmental health and how the environment around us influenced our health as humans. And that wasn't showing up for me, at least not to an extent that I was satisfied with. And so I ended up over in the agriculture school, and I was taking soil science classes and fruit production and greenhouse management, and started learning about all of these other systemic aspects of the built world that I was like, how can we be weaving this into health professional education? And that's what spurred the initial thought of like, oh, I think maybe I could do that in a career. Opened up my ears and eyes to opportunities that were rising. And when I was a senior in my bachelor's nursing program, we had a guest speaker, Dr. Teddy Potter. She's at the University of Minnesota, and she was the first nurse I ever heard say climate change. And all of a sudden I was like, that's my sensei. Like, I need to figure out how to do that. And I graduated, ended up practicing cardiovascular nursing at Abbott Northwestern Hospital in Minneapolis for several years. And I came back to Teddy and was like, look, how do I get on this journey of merging sustainability and climate and planetary health with my role as a nurse? I learned about the Health Innovation and Leadership DNP program there, and basically realized that I needed more education, but also I needed more relationships, and I needed a more established network to start plugging into the people that were doing this work. I learned about Healthcare Without Harm and Practice Greenhealth, which are sister organizations, and we can talk more about that later. But in the past, when I've shared my journey, I've kind of pitched it as like it's this organic evolution, and it really wasn't that at all. Like, I was extremely strategic, and I knew I wanted to work for this organization. And I was really deliberate in building like my own resume, basically, as a nurse that was, where I was able to pitch myself as an environmental sustainability professional, looking through the lens of a health professional and what it meant to take care of patients as part of that. So now what I do is work with a team that supports hospitals and health systems across the country in their environmental sustainability journeys. And to do that as a nurse is extremely profound, because I think oftentimes when we look at sustainability, whatever industry it's in, human health aspects are like ranked consistently lowest as prioritized. And we have the opportunity to flip that.
Yeah, absolutely.
That's amazing. And you were so proactive too in becoming involved in that part of the industry. I think that is incredible. It speaks to your perseverance and your grit to really get in that field and contribute in significant ways.
Well, thank you.
So for those who don't know, Healthcare Without Harm is a global organization that's working to reduce the environmental footprint of healthcare worldwide while also promoting environmental health and justice. And then Practice Greenhealth, as you said, is a sister organization, and it's the hospital membership network part of the organization. So can you tell our listeners about the current climate footprint of the healthcare industry?
Yeah, that's a great question. So when we look at a typical hospital, and I think it's relevant to have this conversation first of like, how is healthcare contributing to climate change? Oftentimes we think about using energy, comes to mind first, like burning fossil fuels. That's what's contributing to greenhouse gas emission buildup in the atmosphere, coal, oil, natural gas, et cetera. And of course, hospitals are using fossil fuels to keep the lights on and maintain temperature, circulate air, et cetera. But there are so many other aspects of healthcare that also contribute to greenhouse gas emissions, thus exacerbating climate change and causing a whole bunch of human health harms. So looking at that footprint of healthcare, the energy utilization is actually a relatively small portion of the overall footprint. It's like 20%.
Oh, wow.
It's actually it's sort of disconcerting, the other categorical areas that are contributing to climate change, because a lot of it is somewhat outside the control of people who are making decisions around sustainability in a health system. So here's an example. The largest component of a healthcare's footprint that contributes to climate change is the supply chain. So we're seeing emissions, from where something is sourced at the beginning, before materials even come into existence as a product. That is part of that product's footprint. Then it's manufactured and packaged and distributed and disseminated throughout a different health system. All of these steps go into the footprint of a product. And obviously we use so many products in taking care of patients in a traditional health system. The food that's coming into the doors of the hospital, feeding patients, staff, visitors, the pharmaceuticals, even the transportation. So staff commutes, fleets, ambulances. Interestingly, this one gets really dicey sometimes, but investments from hospitals comprise about 30% of the climate footprint. So like literal investments in fossil fuel companies count as the climate footprint of any industry, really, but we're talking about healthcare. And the final thing I'll reference is, when we look at all of this combined, a full hospital's climate footprint, if we added that all up across the entire country, the US healthcare sector contributes to about 8.5% of greenhouse gas emissions in the nation. So this cycle of bringing patients in our doors, providing the care that we can for them, contributing to climate change, which exacerbates all sorts of chronic health conditions that are bringing people back into the door. It's this scary cycle that we're trying to help right within the work that we're doing at Practice Greenhealth and Healthcare Without Harm.
Wow. You're speaking on supply chain and all those other aspects of the healthcare footprint. What is a current main area of focus that you're working on right now in your role as director?
Yeah, thanks for that question. It's interesting because at Practice Greenhealth, we have about 1,700 hospitals that are doing this sustainability work with us. But the extent to which they're all committed to the work varies a lot. We have some systems that are extremely progressive and have committed to full decarbonization of all of their operations and all of the things we just talked about. Some have committed to that by 2030, some have committed to that by 2050, but those are like the select few. We have a lot of systems that are doing work around waste reduction and some of the energy conservation, but the room for improvement in terms of quantifying where greenhouse gas emissions are coming from, setting goals to reduce that, and implementing initiatives that are actually working to reduce those systems' emissions. Those opportunities are huge. So I would say right now that's the sweet spot when it comes to climate mitigation, is helping systems transition beyond doing, I'm going to use the term low-hanging fruit. It's not that this stuff is easy, but doing those things that first come to mind around energy conservation and waste reduction, and really accelerating to be working with supply chain or working with other producers and manufacturers and kind of approach it from a collaborative angle. The other piece I'll pitch in here too is climate resilience. So helping health systems be more resilient, not only from their facilities perspective, but also like community health for the climate crises that are already at the doorstep.
Yeah, I mean, it makes sense because you're helping them see that it's possible, really, that they can be part of the solution instead of continuing to contribute and create more patients that they have to treat for things that they are contributing to, and how cyclical it is. Do you think that's why the health sector needs to be part of leading the change and leading and advocating for better environmental health?
Yeah, I think that's one reason. There's a long list of reasons why healthcare must and why we must engage in this. But I think too, like from a healthcare leadership perspective, the priorities that our C-suites are faced with identifying what rises to the top. I mean, I would loathe to be a healthcare executive right now. And so being being savvy about weaving sustainability and climate action into other priorities for health systems is, I think, a really compelling way to approach this. So, for example, like I mentioned, I'm a nurse by background. You're going to be practicing soon, and everybody knows about nursing and other health professional staff shortages. Sustainability can be elevated as a recruitment and a retention tool for health systems. This is happening in other industries, but like every year, Deloitte, it's a consulting agency, they release this survey that identifies the top priorities for millennials and Gen Zs, which comprise the largest portion of the workforce. They identify how they rank environmental action in terms of where these generations are deciding to work, and it rises to the top every single year. So I think healthcare can be positioning their sustainability action for recruitment and retention. It can also be woven into DEI initiatives, especially as it pertains to climate justice. It can be woven into financial benefits. Conservation is going to save you money every single time. So to your question, absolutely, like the mission component of doing no harm is where we need to start. Understanding that healthcare leaders have other priorities where they might wanting to be starting there, but it's a win-win-win-win with all those aspects.
Right, helping them reframe it so they can see it's positive in many areas versus just health.
Right, kind of tying it all together. All I'm thinking about right now is, all the stuff that we use every day. When we're seeing as nursing students, we go through so much stuff, for lack of a better term. The gloves, the syringes, the tube, all of it is just so shocking. And then not only that, but the stuff, like you said, it's inside of it,
how it gets there.
Right. Yeah.
Yeah. All of it.
More on a general standpoint, so looking just specifically at the United States as a whole, we are the world's #1 emitter in both absolute and per capita terms when it comes to waste. What do you think that the United States could potentially learn from other countries who have much lower health-related emissions specifically?
This is a great question. Let's zoom back to like what we can learn from other nations about preventative health in the first place. I think we're facing a crisis of chronic conditions and comorbidities. And I read a really fascinating book, The Myth of Normal by, rats. His name is escaping me right now, from a Canadian physician. It'll come back. Gabor Mate.
Okay.
I'm recommending it to every single human that I meet. And this book helps us understand how that crisis of chronic conditions and comorbidities that I just referenced is also like a crisis of culture. And part of that comes down to a crisis of individual conscience. And we're just in this position where culturally we are not legitimately prepared to take care of our minds and our bodies in a way that positions us for true health. And when we look at the US healthcare system and how we're structured, financial incentivization goes straight to tertiary care. So it's like we almost let people get so bad that by the time they're coming into the hospital doors, I don't want to say it's like a lost cause, but I worked in a cardiovascular unit where we were working with patients with heart failure and heart transplants and mechanical hearts, LVADs, et cetera. And I just kept thinking there is so much we could have been doing to support these people decades ago. And that's not the system we have. It's not the culture we have. So I think looking to other nations and hearkening back to like some of these more ancient classical values of community and elevating personal and family health, that's like a huge issue. But I think part of what part of our healthcare crisis stems from that. Okay, now actually the question that you asked, which was looking at emissions or resource utilization from other nations that we can be learning from. The one that rises to the top right off the bat actually comes out of the United Kingdom. Their National Health Service has prioritized and actually mandated environmental sustainability initiatives across every single department, every single hospital, where the department leads are required to operate within that context of conservation and stewardship. Also, if we look at some developing nations, by nature of less access to resources. Folks are required to be more innovative and conservative in the ways that they are using their materials and their finances, frankly, in the first place. There's a lot of really compelling work that's coming out of Southeast Asia, as well as Latin America. Healthcare Without Harm has some really great landing pages. I can maybe drop in some resources after.
Wow.
But some of that work pertains to like physical material reuse. We are so stuck on single-use supplies here, and reducing the footprint of a surgery, of any procedure, if we're using reusable materials, and of course sterilizing them properly, it's going to save so many resources and so much money. The last thing I'll reference here too, and this is arising in developing nations in particular, is some of that climate resilience work that I referenced, and especially some nations that are in particularly vulnerable places such as coastal areas that are facing a lot of floods or hurricanes or tsunamis, et cetera. They have plans in Malaysia, in the Philippines, in a few other nations in particular that are really facing some of those climate impacts. There are plans nationally at a government level that are prepared for and with health systems. We don't really have something like that in the United States. And so basically looking to governmental support and guidance to craft something so that when we're facing these climate crises, each health system isn't having to establish their own plan and their own thinking independently.
Well, we saw how well that went with COVID. So
yeah, exactly.
Hopefully not coming to that again. But so one thing we are focusing on in our podcast is how our generation specifically can get involved and make a difference. What would you recommend as a tangible action for someone can take?
Yeah, love this question. The most powerful thing we as nurses can do is use our voice. We can try to recycle until the cows come home. That ain't going to do it. We need healthcare leadership. If we're looking at, the daily work that we're doing, we need healthcare leadership to be so bold in establishing goals and putting the financial resources, the staffing resources behind these climate action plans, climate resilience plans. As a nurse, certainly the materials and supplies that we're using every day have a small impact. Certainly the way you get to work every day has a small impact. Certainly the foods that you're choosing for yourself or maybe even your patients has a small impact. But without high-level leadership commitment to decarbonizing, to resilience, to using safer chemicals, without that high-level leadership, it will continue to be deprioritized. And as a nursing student, it's like, oh my God, well, I can't go talk to a CEO on my first day on the job. So I think some of this too, thinking back to like when I was first starting in nursing, get your feet on the ground, become grounded and established in your area of expertise. Like figure out what you're doing first and be thinking creatively about, what the patient stories are that could tug at the heartstrings of these decision makers. Think creatively about what your experiences are on the unit and how you can help problem solve. In my experience, it's like every time you come to a high level decision maker with a problem, you better have a solution. And so some of those initiatives kind of having in your back pocket can be beneficial. But the other thing too is that there's a long list of public-facing commitments that health system leadership can be compelled to sign on to. For instance, we have the Health and Human Services Health Sector Climate Pledge that's charging hospitals with decreasing their emissions by a certain date and building some of those climate resilience plans. There are examples of health systems all across the country. There are over 800 hospital signers now. But some of these health systems have encouraged their leadership to sign on as basically a movement building opportunity within their system. So out of University of Pittsburgh Medical Center, it was a group of health professionals that drafted a letter and put a petition throughout their system and urged their CEO to sign.
Wow.
That's just one example. Yeah. So I think the point about using your voice, combining it with others who are totally stoked to do the same thing that you want to do, is so much more powerful than some of the day-to-day activities, which we need to be doing anyway. But leaning into that advocacy and leadership core pillar of what the nursing role is.
Well, as you know, we're doing this for our class in grad school, but I think as we learn more and more about this, I'm realizing we can't be complacent. I mean, we all have to use our voices, and our voices have power, as you said. So I think that is definitely one of the big takeaways I'm taking. Like I can't become complacent and just think someone else will take care of it.
Definitely, yeah. Well, thank you, Dr. Demorest, for taking your time to be with us and being a part of our podcast. This is extremely important information, like Marie just shared. If we want to continue advocating, moving forward, and like you shared, using our voices, there are steps we need to take. Would you mind letting everyone know where they could find more information regarding healthcare without harm and Practice Greenhealth, please?
I would be delighted. So just visit noharm.org or practicegreenhealth.org. I would also urge folks that are listening to check out the Alliance of Nurses for Healthy Environments. That's the only national nursing organization that's focused specifically on our work within the environment. And I just want to share gratitude to your team for prioritizing this work and framing for others, not only nursing students, but people in practice, people in healthcare more broadly, just everyday humans. Like, we have a crisis in our hands. There are so many ways that we can be contributing to solutions. And part of that is spreading awareness and building hope. And that's what I'm learning just talking with the two of you is that there's so much hope and inspiration, and drawing light to the voices is what can help us advance this movement.
I love that. Building hope. That's what we
and
need.
using voices.
Yeah.
Thank you so much.
Thank you.
I was really grateful for the conversation we had with Dr. Demorest.
Mhm.
As a future nurse, I think it's important that we grapple with the reality that climate change is negatively affecting the health of people and that our health industries are significant contributors to that.
Yes, and I love that she challenged all of us to use our voices. Creating this podcast and learning so much about climate change has been motivating for me to implement changes in my personal life, like utilizing the new styrofoam recycling program or buying reusable instead of single-use items. But we can create even more positive change by speaking up and advocating for leadership to start committing to climate action plans and decarbonization.
Definitely. And if we don't decide to become part of the solution, we are automatically part of the problem.
That is so true. So, moving on, our last guest for this episode is Cameron Houin, and they spoke with us about the important link between climate change and mental health, which is another important topic to consider.
Our last guest joining us for this episode is Cameron Houin, the newly appointed director of the Counselor Education Department at Viterbo University. Thank you for agreeing to be with us for this episode, Cameron. We are happy to have you. Can you tell us a little bit about yourself and how you got into this role, please?
Sure. Yeah. Thanks for having me. Glad to be here. I became a counselor in 2019. Officially is when I got my doctoral degree and was able to start as a counselor educator and teaching others. So around that time, I was looking for jobs and found Viterbo. I had gone to a small liberal arts college similar to Viterbo, but down south. It's called Hendrix College. And I just wanted to go back to a place like that. And so I moved all the way from Arkansas to Wisconsin, and I've been here ever since.
Wow,
started
colder
as a-
weather.
Oh yeah, yeah, very, very different weather. And I'm originally from New Orleans, so I even further south. Yeah.
Oh,
But, I found out I just got to buy the right clothing, the right shoes, and then it's all gravy. But I started here as a faculty member, and just this last summer, our director of the department retired, so there was the opening, and I was interested, and so I'm just entering into that new position this semester. And it is over the counselor education department, which entails 2 master's programs. We have a school counseling program and then a mental health counseling program. And then we have a doctorate of counselor education as well.
wow,
Very cool.
awesome. Well, congratulations on your new position as well.
Thanks. I'm still getting used to it. Very fresh, but I'm looking forward to it. And yeah, here's to new adventures, right?
Yes, yeah.
Absolutely.
So, can you share with us how your perspective on mental health has changed over your life and your career?
Yeah, sure. I think growing up, I didn't think about mental health at all. It wasn't in my world. It wasn't something people spoke about. And so when I got to college and I started having mental health issues myself, I was very lost for a little while and struggled a good bit, and eventually found my college counselor just on campus, that the university provided to everybody. And that ended up helping me get some medication and some longer term help. And I was kind of at a point actually where before the counseling experience, I was considering not dropping out, but taking a break, like just stepping away because my mental health was rough. And going to counseling and getting all that help, I actually ended up graduating, in 4 years, and felt very proud of the work I was able to do, even if it didn't have straight A's, but I had this this personal growing experience and learned a lot about myself. And just thought, okay, well, that's a cool way to help people. Glad it's out there. But even after that, I still didn't think I would end up being a counselor.
Yeah,
So
good for you for making that change and recognizing that in yourself too.
yeah, it takes some guts to go seek out a counselor. It can be a vulnerable thing to do. Can feel uncomfortable to go share with a basic stranger, right? Hey, I'm struggling, or here's what I want to work on in my life.
Absolutely. So during our episode today, we want to dive into mental health and the way that climate change and different things that we're experiencing affect our mental health. In a book entitled All We Can Save, edited by Ayanna Elizabeth Johnson and Catherine K. Wilkinson, from page 79, I quote, "Behavioral and mental health changes have also been directly linked to a worsening climate. Studies even connect climate change to violent crime. Today's evidence of hot weather, a tragic I told you so," end quote. So this past summer specifically, especially here in La Crosse, we were experiencing this poor air quality due to fires in Canada, which I'm sure you're aware. There were multiple days that the air quality was so poor that individuals were continuously encouraged to stay inside. So this kind of relates to COVID in a way, we felt. And how do you personally, Cameron, see this impacting mental health of individuals?
Well, baseline, something as impactful as our weather, our climate, it's going to cause anxiety for many, many people, if not all people, if we're being honest. But it's hard to know that this global thing that we can't actually control is shifting and going to impact every part of our lives, right? Everything from our farmland and the food we eat to, just kind of quality of life in all sorts of areas.
Absolutely.
So I think anxiety is a huge one. And often with anxiety comes depression and kind of the downs, right, of not knowing what's going to happen, that feeling out of control and sense of hopelessness, that kind of thing. So that's the first thing that comes to mind. In addition to that, I always think about who's going to be impacted the most by these kinds of things. Particularly when it comes to the climate, your homeless population, the unhoused, they're going to be hit the hardest, right? Or those who live in communities that are not getting the cleanest water, for example, they're going to be impacted first, and they're going to be impacted more severely over the long term. So these already underserved populations or marginalized populations, or that it's just going to get compounded. So we've got a bit of a mess ahead of us in that regard.
Yeah, definitely. And also in our book, I mean, it even brings up terms like eco-anxiety, pre-traumatic stress disorder. I mean, all these things, like you said, that links to that lack of control and that hopelessness that we can feel sometimes with the changing climate and not enough being done about it. I think it can feel defeating when you don't see enough change and you're so anxious about it. And like some people are raising kids and this is the world we're giving them. And, all of that, it can really compound. It just, as you said, it's discouraging.
I know some folks have been talking about climate change since like the 1970s. It's been a long time that this idea has been around. And like you said, we haven't done much about it as a society.
Yeah, thinking about like these increasing temperatures, air quality issues, these water problems that you're mentioning, especially in this area, the PFAS that we hear so often about, all these things associated with climate change. Do you think, and you kind of touched on this, college students too, are there certain populations of people, aside from the unhoused, that are at this great risk of mental health effects as a result of climate change, specifically in our region?
I mean, certainly the Native American population, the indigenous, are going to be greatly impacted and provided fewer resources, I would suspect, when it comes to disaster relief and that type of thing. Excuse me. And then communities like the Hmong that aren't, part of the dominant community and maybe misunderstood or just kind of othered and not included in people's first thought when it comes to resources, when it comes to supporting. Getting translators, for example, is that going to be at the top of everybody's mind? when it comes to serving the whole of the lacrosse community.
Yeah,
It may not be, but then we're missing out on this population that deserves equal support and resources, just like any other humans out there.
Yeah, definitely. And I think, I mean, I love that you brought up at the beginning, the courage and, the grit that it takes to seek out help when you need it. I think it's also hard because it seems like mental health is kind of a stigmatized topic. And similarly, I think climate change is also stigmatized and can become politically charged, but they can be so interconnected. And we need to understand the importance of caring about them, because there's obviously serious repercussions when we neglect any area of health, whether it's mental health, climate health. So I guess our question for you is, how do you think we get people to talk about these issues or understand that they're important and stop them from being so stigmatized?
Yeah, I think in recent years we've lessened stigma around mental health a little bit, not enough,
Yeah.
a little bit, because people are realizing, oh, it's health. It's not just physical health. It's not just exercise and diet. Health means whole body wellness. And so that's kind of the mind, the body, and the spirit, or whatever you would like to call that. And I think we need to continue emphasizing that mental health is just a part of whole body wellness, and it impacts your physical wellness. In fact, your physical health can go up if your mental health is taken care of. So I think that kind of thing. I also think part of mental health is one's environmental health. And we need to make that clearer and clearer to people as well. Mental health is not just anxiety and depression. It's not just venting to your therapist, right, and getting some advice. It's so much more than that. And if we don't care about the environment, we are not caring about our mental health.
Yeah. And really, people stop feeling so isolated in those feelings if more people are talking about them.
That's right. We can normalize it.
Yeah.
Fortunately, we're seeing this big movement, this strong movement of this younger generation stepping up, normalizing, the talk about mental health, and that full circle, like you're saying, that overall, just, I don't know, like a triad, but there's more than just three parts to health. It's not just mind, body. It's so much more than that. Something that we're addressing as an overall theme in our podcast is how people in our generation can get involved and make a difference. You being, the director of this wonderful program, so we're seeing that already, just taking that leap and being able to help others in that way. What's something else that you feel that someone who wants to make a difference, especially in your area of practice, what can they do to help with that?
Sure. I think there's a million ways to make a difference. If we're being honest, it all depends on what are your skills. Where do you see yourself using your strengths, right? So there's some folks who really like to use their voice and stand up for others, and they're willing to go write letters to legislators or go meet those people in person and advocate face to face for those who don't feel like they can use their voice in that way. And there are others who think, oh, that sounds horrifying. I could never. Let me do this. And they're advocating more within the local community or on a person-to-person basis. But we need every type of advocate out there. And the more I learn about the world, the more I realize there's a lot of social injustice. And so we need advocates from every background and with advocates with interest for every different type of population and variety of mental health issue out there, right? So I think opening our minds up a little bit and not keeping a narrow lens can be really helpful in the first place. But everything from literally being out in the streets and protesting, or fundraising and that kind of thing for those in need. There's things like psychoeducation, right? Just helping other people understand the facts, the research that we have around mental health, around how we can cope in a healthy manner versus less healthy manner. As I was preparing for this, I was looking at some of the coping habits of people when it comes to climate disaster, and they were referencing high risk coping. The American Psychological Association, high risk coping. So not coping that's the healthiest, but coping that can actually exacerbate your stress and anxiety. An example of that is like substance abuse. Right?
It's a very extreme coping.
And it makes sense that as people feel helplessness or feel a lack of control in their lives, there's this kind of impending dark cloud of climate change ahead of us, they're like, well, I might as well just, binge drink, or I might as well just do this, that, or the other, that maybe logically they know is not the most helpful behavior or choice, but it's kind of like, well, why does it matter?
Mm.
So I think another part of maybe the young generation helping, change minds and destigmatize things is helping honor those feelings, right? Yeah, it does feel hopeless. Yeah, it does feel scary not to know what's going to happen. Let's talk about it, right? Let's not sweep it under the rug. Let's honor that and maybe come together as a community, and that's where it starts, right? You form some community, and then through that you're able to actually learn what people need, figure out how to truly help in a meaningful manner, as opposed to just kind of guessing, making your best guess and throwing that out there for whoever can catch it, right?
Yeah. I love that you point out there are different ways to make a difference, because that's true. I mean, everybody is so different and has different skill sets and gifts. And maybe someone would be discouraged if they're more gifted in the background rather than being a protester on the front lines. But everything is important, and every aspect of helping is important. So I love that you pointed that out.
Yeah. That old cliche, "it takes a village," is a real thing when it comes to community mental health, right? Or
Yeah.
societal mental health.
So true. Well, Cameron, we want to thank you so much for being a part of our podcast and sharing your knowledge about mental health as we dive deeper into how it is affected as our climate's changing. So, can you tell our listeners where they should reach out if they're needing help?
Yeah, absolutely. You can always email me at cbhouin. It's C as in cat, B as in boy, HOUIN at viterbo.edu. And I'm happy to nerd out about anything related to mental health or eco-anxiety and that type of thing. But there are, at every university in the United States, you're required to have assistance for mental health. So there are websites and phone numbers you can find. There's also crisis hotlines, national hotlines, ways to get support and be heard. And one benefit of COVID that I've found is there are more online support groups these days that are accessible, whereas other folks used to have to go drive to find some support in that manner. So you're not alone. Just reach out.
Yeah, definitely. Thank you for sharing. We definitely want our listeners to know, if you need help, reach out. You are not alone.
I want to reflect back on something Cameron said during our interview. If we are not caring about the environment, we are not caring about our mental health. What a powerful statement that relates to the entirety of all the themes that we've honed in on throughout this podcast series.
I completely agree. Creating this podcast has been such a fantastic experience, not only for us as hosts, but also all of our peers who worked so hard behind the scenes. They added the magic to these episodes, and all of us learned more than we ever anticipated about our climate's health and the vital role we can play in that.
That's all we have for this episode on the Truth, Courage, and Solutions podcast. A big thank you to our valued listeners. We hope our discussions have inspired each of you to go forth and lead change. We will leave you with a quote from All We Can Save, again edited by Ayanna Elizabeth Johnson and Catherine K. Wilkinson. From page 3, I quote, "You don't have to know the details of science to be part of the solution. And if you wait until you know everything, it will be too late for you to do anything. That's why we, the youth who are leading on climate, are calling this an emergency." Thank you.
To our listeners, again, thank you for your time and joining us for season 2. Keep our podcast in mind next year for season 3, which should air in December 2024. We look forward to having you back as we continue this journey of learning and supporting climate solutions.